Very good evening to one and all. Myself, Dr. Vaishali Vasavada. I'm MS in Obstetric and Gynecology Ayurveda and I'm yoga expert. Right now, I'm working as a consultant and assistant professor at JS Ayurved Mahavidyalaya and PD Patel Hospital at Nadiyad, Gujarat, India. So today I am going to deal with you all a burning topic for all reproductive aged women, that is dysmenorrhea and its Ayurvedic management. So let me share my PowerPoint presentation with you all so that very effectively we can have this session. Okay, so the topic is pain management in primary dysmenorrhea, a multi-model clinical approach. So let us understand first that what is dysmenorrhea. So dysmenorrhea is a painful menstruation of significant magnitude so as to incapacitate a day-to-day activities. We can categorize this pain into three categories, that is mild, moderate and severe. So mild means when a patient is having pain, but after taking some amount of rest, they may feel better, that is a mild variety. The moderate, in which patient has to take some painkiller drugs, then only they can resume their day-to-day activities. That is a moderate variety. And in severe case, patient have to take rest and also she has to take painkiller medication. Even after that, she cannot resume her day-to-day activities and still suffers with the pain. The pain goes only after completion of menstruation. Dysmenorrhea can feature different kinds of pain like sharp pain, throbbing pain, dull pain, nausea, burning or shooting pain. So today what we need to understand in detail, that is primary dysmenorrhea. So when we can consider it as a primary dysmenorrhea. So this is a pain association with ovulatory cycles without demonstrable pathology in the reproductive organs. This is common among adolescent girls and disappear as one grows into adulthood. It may start with onset of a period, but rarely persist beyond 48 hours after the onset of menstruation. So, before understanding the Ayurvedic perspective of dysmenorrhea, let me discuss some basic about Vata dosha. So, Vata dosha is one among three doshas which is responsible for this origin or development of different kind of diseases in the human body. So here, in the pathology of dysmenorrhea, as per Ayurveda, as well as the treatment of dysmenorrhea, we need to focus on Vata dosha more and its subtype. So let us discuss that what is Vata and what their subtypes. So Vata is linked to creativity and flexibility. It governs all the movements, the flow of breath, the pulsation of the heart, all muscle contractions, tissue movements, cellular mobility, and communication through the mind and nervous system. First subtype is Vyanavayu, that is pervasive air. So it pervades the whole body from its seat in the heart, dissemination of nourishment by making blood and different liquid to circulate, and producing locomotion, extension, and contraction, and perspiration and other such actions. Pranavayu, that is forward moving air. So primary air or nerves force reaches out from the stomach to the throat, focus in the cerebrum, administering, inhaling, and swallowing, and also sneezing, spitting, and belching. It is accountable for taking things like food, water, air into the framework. It controls the senses, brain, heart, and consciousness. It is our segment of cosmic life energy and coordinate the other vatas in the body. It decides our motivation or positive spirit in the life and connects us with our inner self. The term prana is likewise utilized as a part of a more extensive senses to demonstrate vata in general, as all vata derive from it. Next subtype is Apanavayu. It is a downward moving air. It extending from navel to the anus, centered in colon. It is responsible for elimination of urine, menstruation, parturition, and sexual activities. Apana, the descending air, carries life force down and bring about devolution or limitation of consciousness. Apana backs and controls all other form of vata and disturbances of it. The disturbances of Apanavayu is basis of most vata issues, as the colon is vata's primary seat. As a downward moving force, when it is expirated, it causes decay and disintegration. Thus, the treatment of apana is primarily consideration in the treatment of vata. So here, in this situation also, even in dysmenorrhea also, we need to focus on apana vayu, its pathology, and how we can specify this particular dosha. What Ayurveda tells about primary dysmenorrhea? What are their correlations, signs and symptoms, and all we will discuss now. So as per Ayurveda, this condition can be correlated with a condition called Udavartini Yoni Vyapad. So Udavartini Yoni Vyapad, the word meaning is Udavartini means the opposite direction or the abnormal direction than that of normal. And Yoni Vyapad, Yoni means here we can consider whole reproductive tract, and Vyapad means a disturbance or abnormality or disease pertaining to that of reproductive tract. So here the Udavartini Yoni Vyapad is one of 20 vaginal disorders explained in Ayurvedic classics. As per Ayurveda, in physiological condition, that is the physiology of menstruation, in that condition is carried out by normally functioning Apanvata, which is a type of Vata dosha. Uterus contracts to release the bleeding. Hence, the improper functioning of Apanvata leads obstruction of cervical and vaginal canal. Hence, the volume and tension in uterus increases and congestion persists in pelvis. When menstrual blood is clotted and associated with piece of endometrium, as this cannot pass through cervix and it causes pain. In normal condition, Apanvata, a type of Vata dosha, moves downward to expel the natural urges and menstrual blood. So when Vata get vitiated, all this will go in upward direction first. That means the menstrual blood or the other natural urges will go in upward direction first, and then it comes down, and in this process woman will develop pain during menstruation. So this explains the almost near about pathology of dysmenorrhea or Udavartini Yoni Vyapad by Ayurvedic classics. So this is a schematic presentation of pathology of dysmenorrhea or Udavartini Yoni Vyapad as per Ayurveda. So first, there will be a suppression of natural urges with other causative factors like lack of physical exercises, use of more oily, spicy and salty foods, lack of personal hygiene, poor digestion, vata imbalance, etc. It leads to vitiation or aggravation of vata, and as of that the upward direction of natural urges will occur, and then the flatus, that is apanvayu, a type of vata, it moves upward and abnormal uterine contraction will occur, and ultimately as of abnormal uterine contraction there will be painful menstruation. So if you look at the symptoms, so first symptom is painful menstruation. So as per modern science, if we understand the reason for pain, then this says that due to overproduction or excessive prostaglandins, which are responsible for smooth muscles or smooth uterine muscle contractions, due to their overproductivity or excessiveness, the pain will increase. So here the same symptom is explained even by Ayurveda. Next symptom is flow of menstrual bleeding will not be free. There will be a frothy menstruation. Menstrual bleeding is unctuous. The flatus will not pass freely, and the presence of clots in menstrual bleeding. And another symptom, a main symptom is once there is a passage of clots or once there is an end of menstruation, patient will feel relief. That is the main prodromal symptom for Udavartini Yoni Vyapat. So if you look at the common site of pain, so the pain located in the region of bladder, flank, epigastric region, hypochondriac region and umbilical region and back. So these are the most common site for the pain during dysmenorrhea or Udavartini Yoni Vyapat. Patient to patient or person to person, it may differ. The site of pain may differ. So now let us discuss the management line of Ayurveda. So the uncoordination or irregular contraction of myometrial muscle fiber can be explained as all around movement of vayu. So which is the characteristic feature of apana vayu in particular, along with Yana vayu, and their vitiation produces pain. So when we see the function of Yana vayu is relaxation and contractions of muscles, and the function of Apana vayu is expulsion of menstrual blood. So when these two vayu get vitiation, then their function, namely that is contraction and relaxation and expulsion of menstrual blood, will hamper. And due to that, the pain will arise. Hence, Vata pacifying line of treatment can be advised, which includes first is nourishment. How nourishment? Because uh, when we give nourishing drug or nourishing diet, it has properties like sweet, unctuous, and heavy properties, and which is opposite to that of that the property of Vata. And as per modern concept, if we understand this, then pain occurs. The main one another reason for pain is lack of oxygenation. So when we advise nourishing food to the patient, then oxygen supplement to the cells, to the each and every cells of body will be fulfilled, and we can reduce the pain. Next is internal medication. Next, local treatment through vaginal route. Only in case of married patient, we are advising local treatment through vaginal route. Next line of treatment is Panchakarma procedure. So Panchakarma procedure is a combination of 5 procedures which is helpful for detoxification of body, and in that especially enema therapy, we also call it as Basti or Basti therapy, that is a medicated enema that have proven the best in case of dysmenorrhea. So a series of medicated oil enemas and decoction enemas administered after the Ayurvedic massage and steam therapy. Uttar Basti, that is a procedure of therapeutic herbs and are administered inside the uterus. This helps to remove the blockage of channels and provides more nutrition to the uterus. So in internal medication, there are some formulations which in detail we will discuss in next slide. They are Shankvati, Rajapravartanavati, Kanya Lohadivati, and Sthanik Chikitsa, which includes lower abdominal massage with oil of Asafoetida over lower abdomen, and other Sthanik Chikitsa for married women are vaginal tampons. In Panchakarma procedure, Basti, that is medicated enema with The milk processed with dashamula, that is root of 10 inflammatory drugs, by or by sesame oil or by balatel, that is oil of fennel weed. So here in the diagram, you can see the flower and the leaves of fennel weed, and in upper diagram, you can see the Asafoetida. In Sanskrit, it is called as Hingu, and also Uttarabasti with oil of fennel weed also can be advised. So the first formulation, that is Shankhavati. So the ingredients along with its picture, that is, first ingredient is all types of salt. There are total 5 types of salt. Lemon juice, fine powder of burnt conch shell, Asafoetida, ginger rhizome, black pepper, long pepper fruit, purified mercury, aconitum ferox, and purified sulfur. So all these ingredients in diagram also you can see how they look. Next is Rajo Pravartini Vati. It includes aloe vera, that is Indian aloe, the extract of it, Asafoetida, borax powder, and green vitriol. The green vitriol means the purified green vitriol. All these 4 drugs, along with its picture, you can see. Next is Kanya Lohadivati. It includes aloe vera, green vitriol, cinnamon, cardamom, and dried ginger. Next is Dashamula oil. So Dashamula oil, Dasha means 10 and Mula means root. So 10 root, the root and root of group of drug, they are responsible for anti-inflammatory and also they are painkillers. So in that, Salpan root, Indian Uraria root, Indian nightshade root, yellow berried nightshade root, land caltrops root. In diagram you can see their appearance for identification. Bengal quince root, white tick root, trumpet flower tree root, Premna ceratifolia root, and Indian trumpet tree root. So when looking into the diet and regimen, so here daily regular exercise should be done. At least minimum of, if one cannot do heavy exercise or yoga, then at least minimum of 20 minutes of walking is advisable. And bowel should kept clear because suppression of urges is one of the major cause for dysmenorrhea. So bowels should always kept clear. Increased intake of iron, calcium, potassium, and vitamin-rich diet. One of the major factor that influences Vata is food. So food such as cold food, frozen food, large beans, dried fruit, and foods which with bitter, astringent, and pungent flavors, this aggravates Vata. So, however, consuming sweet, sour, and salty flavors with sweet, oily, and rich foods can help in balancing of Vata. They are having opposite property to that of properties of Vayu. So, food with heating effects balances Vata. So, all the ingredients which we have listed, which I have listed, almost all they are having the heating property. That is why these combination of drugs are helpful for balancing Vata. And other like food that is cold and frozen, that disturbs the balance of Vata. Next is the treatment suggested by CCRAS Ayush Department, New Delhi, India, that a decoction of Triphala, that is 3 myrobilans, so the 10 to 20 ml twice a day is advisable for entire month for about 3 cycles. Decoction of Dashamula, that 10 group of drug which we just discussed, about 20 to 30 ml of a decoction is advised twice a day. And vaginal tampon in case of married patient with Ksheerabala Taila should be kept in vaginal canal for 15 minutes daily for once a week. So next I have some case series which I have treated at the OPD of PD Patel Hospital, Nadiyad, Gujarat, India. Mainly I have diagnosed them as a primary dysmenorrhea and I have treated in this OPD. So let us see these case. So case 1 where the patient is of 21 year and she was student, an unmarried patient, and the duration of disease was 6 to 7 months, and the treatment I gave to her was tablet Arend that is castor. The main ingredient is a castor oil, and uh, advised for 2 tablet 2 times a day with warm water. Warm water as a anupana, we call it as anupana in Ayurveda, or as a supportive or as a improving agent for a drug effect. Another medicine is tablet Rajopravartini Vati, 2 tablet thrice a day, 3 times a day after food. So Rajapravartini Vati also we just discussed about its ingredients, and the duration of this treatment was 3 to 4 months and patient have got complete relief. When we look at case 2, in that patient's age was 22-year, occupation was housewife, and patient was married. And the duration of disease was since menarche. In this case, we have advised Erandaprust Herde 3 BD, that is 3 tablet twice a day with warm water, and one of Panchkarma therapy, that is Basti therapy, a Matra Basti with Bala Taila, for around 60 ml of Bala Taila was introduced through anal route for 7 days before menstruation, and like this up to 4 to 5 month treatment we have given, and the result was complete relief. Another case, patient age was 38 and she was businesswoman and married. At the age of 38, it is very difficult to conclude the pain during menstruation as a primary dysmenorrhea, but as the definition says, as I have not found any underlying pathology in the sonography report, so I have categorized this case in primary dysmenorrhea, and duration of the disease was 5 years, and treatment given was a Brahmi Churna 5 gram 3 times a day with milk, Erendbrust Harade 3 tablet at night time, Nasya Karma with Brahmi Grut 6 drops in each nostril for 7 days, and duration of treatment was 6 months, and the result was complete relief. So here, so Eranda means castor seed oil. So that is, you can see in this diagram, the leaves and the seeds of castor. Herde is Terminalia chebula. You can see the appearance of Terminalia chebula. And Brahmi, that is Bocopa moneri. So that is this shape, the heart-shaped leaves, which is used as a, which is processed with gruta and used for Nasya Karma. Nasya means nasal drop therapy, in which we are asking patient to lie down in a supine position, and we are instilling 6 drop in each nostril. Once the medicine reach to the throat region, then we are asking patient to spit it out. So due to the effect of nasya or effect of nasal therapy, uh, it stimulates or it regulates the hypothalamo-pituitary axis, and in turn it helps in balancing the hormones, and it also affect on limbic system, that is a point or a spot for emotions. So in cases like psychological cases, like where patient is taking over stress, over exertion, in such case we can advise this particular treatment. So Brahmi is a very useful drug, and it is very much effective in case of this type of cases when patient is suffering with dysmenorrhea due to over exertion, over stress, and other psychological factors like depression, anxiety, etc. So that's why I have chosen the drug Brahmi for Nasya Karma, that is nasal therapy. Then let us discuss the how this treatment is working on dysmenorrhea, like multimodal approach. So we have in this multimodal approach, I have approached to the dysmenorrhea cases with the help of panchakarma procedure, like that is detoxification of the body, uh, procedures like Basti Chikitsa, that is enema with drugs, decoction or oil, and nasal drop therapy, and some of the pacifying or oral medication. So when we look at the incidence, so the incidence of dysmenorrhea is affected by social status, occupation, and age. So group of college student, high school girls, factory workers, and women workers of armed forces each provide a different statistic. So in this group of girls, we are finding more cases of dysmenorrhea, and its treatment is of great importance to the physician in a view of interruption of patient's economic, social, and personal life. Vata dosha is dry, cold, light, moving, changeable, subtle, rough, and quick. So these are the properties of Vata dosha. Hence, for treatment, we need opposite quality drugs. So if we observe, if we observe in this case series or the management of Ayurveda, then almost all drugs are having properties like hot and unctuous and capacity of to pacify vata. Enema has both local and systemic effects. So gut is a sensory organ consisting of neural, immune and sensory detectors and cells, and provides direct input to local regulatory system and information that passes to CNS to or other organs. Enema may stimulate the enteric nervous system, and thus it can influence CNS and all bodily organs. Enema may act on neurohumoral system of body by stimulating CNS through ENS. It thereby restores the physiology at molecular level. It can also act on inflammatory substance like prostaglandin and vasopressin. So when we see the modern aspect of dysmenorrhea, prostaglandins are more in such case, and also vasopressin, a hormone which is responsible for uterine contractions as well as bladder contraction. So these two hormones are more, and the Basti Chikitsa or the enema therapy is also giving impact or effect on these two hormones. It may also help to excrete increased prostaglandins due to Nasya Karma, that is a nasal drop. A visceral afferent stimulation may result in activation of hypothalamo pituitary adrenal axis and autonomous nervous system, involving the release of neurotransmitters like serotonin and hormones. Thus, it normalizes the neurotransmitter, hormonal and neural pathways, and relieves all the symptoms complex emerged as a result of neurohormonal imbalance in the patient of dysmenorrhea. And also, Nasya Karma or nasal drop therapy also helps in case of psychological conditions or the cause where the psychology is involved. So let us move towards conclusion of this presentation, that Udavarta Univyapad or dysmenorrhea affects the majority of women every month disrupting their normal functioning and quality of life and interpersonal relationship. So the Ayurveda, the science of life, the main aim of Ayurveda is uh, prevention of the diseases, and another is cure of disease. So for prevention of this particular dysmenorrhea, Ayurveda have given many rules and regimens to the woman so that they can prevent this type of gynecological disorder. So in the field of gynecology, it's the prevention starts from preconceptional care. So for example, a lady of at 22 years, when she is taking preconceptional care uh, to achieve next progeny, then due to positive effect of that Ayurvedic preconceptional care, her next coming progeny will be healthy, the conception will be healthy, and the initial growth of embryo will be healthy. And if that particular embryo is going to convert into a female child, then during that intrauterine life, if she is following proper care and every month rules and regimen explained by Ayurvedic concepts or Ayurvedic science, we call it as Masanumasic Garbhini Paricharya, then the whole body of that female fetus, including reproductive system, will grow in healthy condition. And after the birth of that female child, if the mother focus on her nutrition and her proper growth and development, then she may be free from all types of morbidities during which is arising during pubertal age. And one of that morbidity is dysmenorrhea. So, and along with it, even after puberty, at the time of menstruation also, Ayurveda have given many different type of rules and regimens. If we are going to follow that accordingly, then definitely um, the patient or the society may have a healthy reproductive life of a woman. And likewise, if the woman is having healthy reproductive life, then the upcoming progeny of the country will be a very healthy and strong. So, and also the Ayurveda concept of treatment, if we see, the first line of concept is avoidance of cause. So first we should withdraw a patient from the causative factors. Then only we are able to achieve the treatment fruits. Otherwise, if patient is taking our treatment also and indulging into the causative factors also, then treatment fruits may not be achieved. Hence, clearing the pathology first is the main aim of the Ayurveda, not just merely relieving the symptoms. So in this condition, once we pacify Vata, once we are succeed in pacifying the Vata dosha, specifically Apana Vayu, then we are achieving in this condition, or we will be successful in the treatment of dysmenorrhea. At last, I would like to acknowledge Team Apna for giving me this wonderful opportunity, and especially Professor Vedya Shekhar Annam Botla sir. I am very, very thankful to you, sir, and I highly acknowledged to you. And I also acknowledge Professor Dr. S.N. Gupta, Director, International Activities, Professor Dr. Pradeep Vaishnav, Director, PG Studies, and Professor Dr. Kalapi Patel, Sir, Principal and Medical Superintendent of JS Ayurved Mahavidyalaya and PD Patel Hospital, Nadiad, uh, for giving me support in this clinical work, because I have done this clinical work in my OPD at PD Patel Hospital. And I also acknowledge all the colleagues, friends, and nursing staff, even a nursing staff who helped me in this clinical work. And at last, but very important, I acknowledge my sincere patients who gave me opportunity to make this clinical work successful. Thank you. Thank you all.